Hi, it's Chrissy, and today I wanted to do a video because it's Blood Cancer Awareness Month. So I wanted to do a blood cancer Q&A and cover the top questions that people have about blood cancer. So let's get started. The first common question people have about blood cancer is, what is blood cancer? So blood cancer is a cancer that does affect blood cells like white blood cells, plasma cells, red blood cells, and the lymphatic system. When these cells kind of go rogue, they crowd out the healthy cells, and that causes abnormalities with people within their bone marrow and normal blood function. One common factor that happens as a result of this is anemia. So chronic anemia can also lead to diagnosis for blood cancer in some cases. The most common blood cancers are leukemia, lymphoma, and multiple myeloma. So the second question that people have about blood cancer is, what causes blood cancer? And there are a lot of theories around what causes blood cancer, but they don't have any definitive reason that they can specifically pinpoint for what the cause of blood cancer is. In the case of multiple myeloma, there is a lot of research that exposure to toxic materials like Roundup and other chemicals may be a contributing factor. Some people in research have said that exposure to numerous X-rays may be a contributing factor to multiple myeloma. They do believe there are certain professions that are more prone to getting multiple myeloma, like farm workers and firefighters. And there has been some connections between blood cancer and 9/11 first responders. So they don't really know, but they kind of have a broad idea that if you're exposed to toxic materials, that could make you more prone to getting a blood cancer. The third question that people ask is blood cancer curable? So this is a bit tricky because most times when you're dealing with a cancer diagnosis, they look at your 5-year survival rate. And when you look at the top 3 different cancers, they all have differing 5-year survival rates. Some are better than others. And right now, there are a lot of advancements in treatment like CAR T-cell therapy, which is allowing some people with blood cancers to have very long, extended remissions of 5, 6, 7 years or more. That's not necessarily the case with myeloma as of yet. At this time, multiple myeloma is considered incurable, but highly treatable. So we're praying for a cure, but at this time, they don't have one. But there are a lot of options for treatments: chemotherapy, immunotherapy, immunomodulatory drugs, CAR T-cell therapy, and bispecific T-cell engagers. So there are a lot of treatment options to help people who are dealing with this diagnosis. The next question that people often ask is, how is it diagnosed? How do you find it? And what I found is a lot of people find out through routine blood work. If something looks abnormal, then a hematologist may get involved and dig a little bit deeper. As I mentioned previously, anemia can be a sign of multiple myeloma. But if they have an idea that you are dealing with the blood cancer, they're going to put you through a round of tests, including PET scans and a bone marrow biopsy. So that's usually how they diagnose it. And the last question that some people ask is, how often is it diagnosed? Statistically, every 10 minutes in the US, someone is diagnosed with a blood cancer. So it's pretty frequent that someone is diagnosed with a blood cancer, in my opinion. And as time goes on, I find that people are becoming more aware about blood cancers than they were before. For example, when I first was diagnosed with multiple myeloma, I had never even heard of multiple myeloma before. That was not even something I ever even knew about. It wasn't on my radar. But now I see more people are becoming more aware of multiple myeloma, and there are studies like the PROMISE study, where if you are related to someone who has myeloma, you can get tested to see if you have any contributing factors that make you prone to myeloma. So there's more advancement in becoming aware, which is why I wanted to do this video, because it is Blood Cancer Awareness Month, and I wanted to raise more awareness around blood cancer. So I hope you found this video beneficial. Be sure to leave a comment and subscribe to my channel. If you want to know the story of how I was diagnosed, you can check that video out next. I'll link it to this one. And thanks for watching. Have a good one.